Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. And this is the first time I've done this. I'm not even going to do an intro because everyone that sees this person's face, you are immediately going to know who she is. And she does not need an introduction. So, without further ado, welcome. I don't know why it took this long for us to be on a podcast together, but I'm so excited to have you here. Let's start off. Let's assume someone doesn't know who you are, which I'd be shocked. Tell them, who you are, what you're building, and we'll dive into the episode.
Wow, that's way too generous, Jared. Thank you so much for having me. Hello, everyone. I'm Solome Tibebu, and I'm the founder of Behavioral Health Tech, which is the largest community focused on expanding access to mental health, substance use care, and IDD services through technology, health equity, and innovation.
And even even before you started this up, I think you were always involved at these other events, and people were seeing you speak and moderate. And what caused you to say, I want to start this community, on day one?
Mm-hmm. Yeah, it was really, so I've always been involved in behavioral health. I had really severe anxiety and obsessive compulsive disorder as a teenager. There wasn't really anything online at the time. And I was a teen growing up in Minnesota. My parents were from Ethiopia and Poland, respectively. So we weren't really talking about mental health in the household. So you can imagine the challenges with that. In fact, they once I finally got the diagnosis for obsessive compulsive disorder, which took 4 different providers to get, mind you, my parents said they had never even had a vocabulary for OCD in either of their languages. And so I struggled a lot trying to navigate and manage. And in 2006, when I was 16, I started anxietyandteens.com as the first 14 by teen online resource because I wanted other teens to be able to access information and know that they weren't alone. And so my passion for developing community, expanding access to services and information, mental health, innovation really started at an early age. And then fast forward during the pandemic, I saw that a lot of the in-person conferences were shutting down. And I thought, well, there should be a virtual behavioral health conference. But knowing any idea of what goes into that. And that was really just the beginning of it, was to bring folks together to discuss what are the barriers standing in the way of expanding access to more care, and then showcasing real world examples of people who were launching partnerships successfully to deliver said care to accelerate that progress nationwide.
Well, and first, congrats on everything that you've accomplished thus far. And I love how you're like, yeah, I'll start an event, and then you probably quickly realize, like, wow, it is a lot of work. I mean, you probably knew that going into it, right? But everyone's kind of, I feel like as entrepreneurs, we need to put, even when we're not naive, we need to act naive to certain things or we won't do it, right? Like, oh yeah, you can put a large event on that's going to rock, right? What were some of the initial pain points? Let's talk about maybe first year and building this.
Mm-hmm. Yeah, so we did virtual 3 years in a row before our first in-person event last year. And it was early COVID, and my first questions were, are healthcare people even ready for a virtual event? Which is, of course, so funny because they just eventually exploded. And um, but yeah, deciding on what was in scope and not, just making sure we were really focused on immediate pain points of quickly disseminating what's working during the pandemic. So uh, payers, providers could pivot quickly to help get the care to folks who needed it. But then eventually deciding to go in person, that was just a whole new world of unknowns. Let's just say that.
And that probably brought initial maybe challenges, pain points when you decided, okay, we're going to go in person. So,
Mhm.
but I think your approach to doing virtual first probably alleviated a lot of the initial pain points of even an in-person event, right? I don't want to put words in your mouth, but I'm assuming
Hmm.
because same process, right? In terms of getting speakers and sponsors, it's just now there's the venue selection and all the other additional parts that come with it. Um, how in the early days, obviously, probably having less support where you were doing a lot. Like, how did things change as you were able to bring on additional team members to help you with this?
Mm-hmm. Yeah. I agree. I think virtual was certainly a nice baby step to validate the concept and uh, ensure that there was demand for a convening like this and be able to test that sponsors were willing to pay for it. Um, but now, even in our second year, I'm still very much a startup. We're completely bootstrapped. It's a very seasonal business. And so that can cause a lot of anxiety. But we've had great partners who have committed to supporting us earlier in the year. That's been really helpful. And so we went from just two of us full time to now five of us. And that's been uh, extremely helpful.
What are you most excited about for this year's event?
Mhm. Yeah, for this year, again, looking forward to bring back a diverse set of stakeholders. And so that includes national and regional health plans, employers, benefits consultants, behavioral health providers, whether that's large health systems or community mental health clinics, individual practitioners, investors, startups. But this year, I'm super excited because in addition to doubling down on our mental health and substance use content, we've expanded into autism and intellectual and developmental disabilities. There's a lot of innovation happening in that space and a lot of overlapping stakeholders. So excited about that. And personally, we're bringing back our Young Innovators in Behavioral Health Awards, which last year, in partnership with some amazing organizations like Pivotal Ventures, Hope Lab, we brought 30 young people who are doing amazing work in mental health and recognize them on stage and giving them some visibility to people who could help accelerate their projects. And I'm personally very excited that we could do that again this year.
That's exciting. And those entrepreneurs probably love that recognition, right, and the ability to be at your event.
For a lot of those young people, it's the first professional conference they've ever been to. And I think back to the first conference I ever went to was the International OCD Foundation conference. And a little different, wasn't a business event, but it was the first time I had been in a room with so many people that struggled with obsessive compulsive disorder. And for such a stigmatized, misunderstood condition, this was just such a powerful experience to connect with others who were going through something that I was so alone in. And so, yeah, I'm excited to take from experiences like that and recreate them at BHT.
And what is your take on the current state of behavioral health? We don't have to talk about the digital side yet, just in general. I know it's been interesting to see a lot of companies kind of get started over the last couple of years, continue to grow, but would love to hear your thoughts on where the industry is today and maybe what gaps still exist that you would like to see maybe resolved.
Mm-hmm. Yeah. So, of course, with the pandemic has died down, but unfortunately, the impacts of it have not, especially when we're talking about youth. Unfortunately, I do think the impacts of that is going to continue for several years beyond. There's still more demand for services than ever. And so, while as you alluded to, a lot of companies emerged and raised a bunch of money, I do think it's harder for them to raise their next round and continue to grow and scale. There's a lot of competition, but the reality is there's so much opportunity to reach and serve so many more people who need the care that I just think it's going to take some navigating, but eventually there's still so much opportunity for many of these companies to uh, measure and improve their outcomes and evolve their services, establish their distribution channels, which is half the battle a lot of times, and actually get that care to folks.
Do you think we're approaching the second half now of 2024, which is wild to even say. Do you think we'll continue to see consolidation like these either I don't want to say companies shutting down because I think you'll see probably more like acquisitions and mergers happening. But do you kind of see that as well in terms of we'll continue to see that consolidation continue to happen?
Hmm. Yeah, I think at this point in time, all of the easy stuff has been done, like the mild to moderate anxiety and depression that's saturated, and it's exciting to see more personalized and specialized companies that are really tailoring their solutions to meet the needs of folks who have specific issues. For example, Equip, specifically for folks struggling with eating disorders. But now I think we're at a point where companies, or payers rather, they have solutions in their portfolios already. And if startups want to be successful, they've got to think about how are they going to coexist in those portfolios? How are they going to integrate with them? And I do think that bar, the expectation for them figuring that out is going to increase quite a bit. And I do think there will be quite a bit more consolidation. It just only makes sense.
What is it about this space that seems to attract celebrity, either advocates or like investors?
Mm-hmm. The reality is behavioral health issues impact everybody, no matter what your socioeconomic status is, whether you're a celebrity or not, it's going to reach everybody. I guarantee that folks who are listening to this are either going through something themselves or somebody in their immediate family or friend group. It's so pervasive, and so of course it's not surprising that celebrities are connecting with the mission of a lot of these companies and want to do something to help.
Yeah, because I remember, was it at like health, you had like Howie Mandel with I think it's No CD, right?
Mm-hmm.
And then you had a few others. It is interesting whenever you can also get their thought because it just gets amplified, right? It's not that what they've gone through is any more difficult than the typical patient, but when you do have that celebrity come forward and start telling their story, it gets way more amplified. So it's obviously welcome when that happens. Um,
Mm-hmm.
what do you kind of hope for the next phase of behavioral health? Like, is there anything that you're like, this is on my radar, I'm looking out for, and I would love to see more of? Like, we'd love to hear that from you.
Yeah, yeah, and I'll just plus one on what you said with the like that panel was just so wonderful hearing how he speaks so personally about what he was going through. Especially there's in behavioral health, the stigma is still there. Next generation, it's wonderful to see how many young people are talking about their own mental health and raising their hand to uh, reach out for care. But the reality is there's still so much stigma, especially when you're talking about substance use and severe mental illness. And so to be able to have people in positions of power or reach talk openly about their experience and let people know that they're not alone, it really is. I mean, as cliche as it is, knowledge really is power. So that was a really great session. But to answer your actual question, um, where would I like to see things go? Yeah. Well, I would like to see it's starting to happen a bit, but um, there can be really innovative, novel, scalable behavioral health solutions with models that are maximizing the efficiency of the small workforce that we have, leveraging technology to reach that many more patients in a high quality, effective way. But if there isn't a payment method for them to get covered by plans, then they're not going to see the light of day. It's exciting to see that there have been quite a few progressive payers that have worked hand in hand to co-develop with companies and patients, of course, super important, to come up with innovative bundles and whatnot to disseminate the solutions. But I do think there's still a lot of opportunity for more payers to learn from a lot of these earlier innovators so that these startups can get access to actually serve patients.
There's still some frustration though, how obviously there are some forward thinking payers that are like, this makes sense. It does seem to take the payers so much longer to like think of how many companies have started and they had a super ambitious vision and it made total sense what they were going after specifically in this space. But they were kind of banking on the right payment model, which was still risky, right? Like they were building a business hoping that the payment model will change, which there was no guarantee that it would change. Um, you kind of think back even when you go to a different industry with Uber, right? Uber kind of did the same thing. They built a company and they needed the taxi company, the taxi board and commission to
Mhm.
kind of go with them. But I guess how can companies like what is your advice to companies that want to first start? Like, do you suggest they still start even if that payment model and then put the work in to try to get that payment model? Or are you like, we have a lot more groundwork to really push for these new payment models to exist and then let's see these new companies come
Mhm.
forward?
Yeah, I would say on the bright side, on a more positive note, uh, the demand has been so significant these last few years that I do think a lot of payers are embracing the fact that not only if we address the behavioral health issue, are we going to reduce these huge costs in comorbid physical conditions? There's just ample data for that at this point. But also, we have to turn to innovative technology integrated solutions if we're going to do something about this crisis of mental health in our country. And so I do think there's more appetite for them to be able to learn what they can do, learn from their peers, and figure it out. And so that is a great atmosphere to be in. And so for the startups in the audience, finding those forward thinking individuals within plans that would be willing to co develop the solution together, coming in with humility and understanding the specific member base of that regional plan, say, and work side by side to actually bring it to life together. That is really what I think is the most successful way to approach it.
What are you most looking forward to in regards to your event?
Hmm. Most looking forward to? Um, oh, that everything goes smoothly, if I was totally candid. Um, I'm I'm really most excited for people who would not typically run into one another, having the opportunity to connect. That was probably the most common follow-up email I received from attendees was, "Wow, I met so and so, and now they introduced me to who is now my new co-founder," or we found this deal and our fund has now invested in this company as a result of sitting down with this company at your conference. And it's just so satisfying to be able to get messages like that. And any way that I can make this industry more efficient in developing the right partnerships, that's what I'm most excited about.
What about in terms of themes? I know
Mm. Mhm.
what should let's say there's already people that are committed, they're going. This is kind of the pitch to the people that maybe haven't yet either gone through that registration or they're still or even actually no, they're going. Just like what kind of I don't want to bucket you into like what's the one thing though because I know you like all of this, but I'm gonna bucket you into what's the one thing like
Damn it,
that you're
I'm
really
afraid in a
excited
box.
about topic. Yeah.
um, yeah, I would say uh, while I'm looking forward to having all those same stakeholders that I mentioned earlier, uh, payers, startups, investors, policymakers, we are also expanding our community mental health program in partnership with Consulting for Human Services, which has had decades of experience working with community based organizations. And I'm really excited about this expansion because the local providers, local community based organizations, these are the groups that have been doing the effective work in their communities and have the trust of patients in their communities, but have been basically left out of the technology evolution in behavioral health, and they weren't part of meaningful use. They didn't get access to those high-tech funds. But now um, with CCBHCs, and there's new programs that are allowing these community-based organizations to access funds to be able to adopt technology. And so I'm really excited to invite this population to come and be exposed to the innovation that's happening and help bridge the gap between this digital divide of community-based organizations and uh, the VC-backed digital health startup world.
I love it. I'm so excited for you. And let me just say, not to just keep showering you with compliments, but like your energy when you
Yes, I
run
know.
into you at an event, and we talked about, you take the, like you take some like awesome photos with people, like so excited and happy, and um, thank you for continuing to be you, and be, a fun presence to be around. And I'm glad that we were finally able to have you come on the podcast.
Man, that means so much. Thank you, Jared. And for those wondering, that photo on LinkedIn probably took like 12 takes of me closing my eyes before we finally got the right one. And but yes, thank you for having me, and really excited about the work that you do too to share my and so many other people's message.
Thanks so much.